Worried your vasectomy reversal didn't work? Are you confused by your semen analysis or feeling stuck without clear answers? In this episode, I talk with Dr. James Smith, professor of urology at UCSF and chief medical officer at Fellow Health, to clear up the confusion. We're going to break down what makes a good semen analysis, how to avoid misleading results, and simple ways to boost your sperm health naturally. So if you're asking, did the reversal actually work, or what else can we do to improve our chances? This episode is for you. Feeling like this whole baby making journey is never going to work out? You've done it all: diet changes, supplements, tracking your cycle, and yet the pregnancy test is negative. It's so frustrating, and you're asking yourself, why isn't this happening for us? I'm Susan Gladstein, a holistic fertility coach and mom to 7, including 2 miracle babies after a vasectomy reversal, and I get it. Being told everything looks fine by doctors while still feeling stuck can leave you feeling hopeless and confused. On this podcast, I'll share practical, natural ways to support your fertility without all the overwhelm. Forget the everything's normal talk and the rush into fertility treatments. I'm here to show you a better way. If you're ready to take practical steps that fit with God's plan for your family, you're in the right place. I truly believe that you can have the baby you've been praying for. If you're in the trenches of trying to conceive after a vasectomy reversal, I know that one of the biggest stressors on your mind is sperm health. Is everything working down there? Is the reversal successful? How do you actually know if things are on the right track? I know that for some, getting a semen analysis can feel overwhelming. Maybe your doctor hasn't been super clear on why it's important. Maybe cost or convenience is holding you back, or let's be real, the process itself isn't exactly the most comfortable or fun part of trying to conceive. That's why I'm so excited to have Dr. James Smith here today. He's a professor of urology at UCSF and the chief medical officer at Fellow Health, and he's spent years helping men get clarity on their fertility. We're going to break down what makes a high-quality semen analysis, why that matters, and what you can do to improve sperm health naturally. But before we get into all of that, I would love for you to tell us a little bit about yourself and what led you to specialize in reproductive health.
Well, Susan, it's nice to be here. Thank you so much for having me on. So as you said, I'm a professor of urology at UCSF, so I've been director of male reproductive health at UCSF for many years, before just in the last 2 years becoming chief medical officer of Fellow. But I took this journey because I saw when my wife and I were going through this journey. When I was a urology resident, we were going through fertility treatment, and I saw the kind of impact that fertility specialists could have through their knowledge and their compassion for patients. And I decided that was something I wanted to do. And I wanted, from the urology standpoint, I wanted to be able to help couples conceive as best I could.
I love that, because I think that there's really, well, personally, I feel like there's no greater calling than to help people have babies, especially in my community, because it's like they're spending lots of time and money and effort on making it happen. And there's a lot of times I find that there's just not a lot of support there. Maybe the reversal doctor doesn't have a lot of follow-up care or guidance, or if you go to a fertility specialist, it's usually, and I'm being very general here, but it's a lot of the time very specific to the female side. But obviously my clientele are all hyper-focused on the male side. So I'm curious, I know in my experience, I was just told, like, well, all the numbers look great, everything's fine, you should just go to IUI or IVF. And there's not really a lot of direction given on even how to actually optimize sperm health. So from your perspective, why do you think that there's kind of this gap in between follow-up care, or even what should couples be doing post-reversal or even beforehand to really improve that sperm health?
Yeah, I think that you bring up some really, really important points that are they're part of how men and women are often different in how they seek care and have access to care in the United States. Broadening our conversation just for a little bit before talking about the vasectomy reversal, many times women already are plugged into the healthcare system. They often have a gynecologist, often have been getting pap smears and regular care for many years, which is, primary care. And so when questions come up about reproduction, there's a go-to person for a woman to talk to. But men, we often do not have that. It's often, a hernia exam or something during high school, and there isn't this connection to the healthcare system. So when men are starting to think about having a family, often the care is initiated through their spouse. And so it's tricky. So then their spouse's gynecologist is being asked to get a semen analysis, not on her own patient, his or her own patient, but instead on the partner who's the patient. So it's tricky. Often the gynecologist doesn't feel terribly comfortable ordering a semen analysis, doesn't feel terribly comfortable interpreting the semen analysis. And so that often leads to a referral for that man to an REI, to a woman's fertility specialist. And there, really, the incentive is to do intrauterine insemination and in vitro fertilization. And really, they don't really necessarily have the training to evaluate a man, to evaluate all the kinds of things about a man that he could potentially do to improve his fertility health. And so, with that in mind, when I see a man and he comes in, when a man has come in for an evaluation, I think about his overall health, and fertility can be a reflection of his overall health. So I'm asking, does he have high blood pressure? Does he have high cholesterol? How's his weight? How's his exercise? How's his diet? What kind of medications is he on? And there are many medications that can impact fertility, from testosterone to blood pressure medications, and many others in between. These are the sorts of things that a urologist is thinking about when he sees a patient, whether it's before a vasectomy reversal or after a vasectomy reversal. We're thinking, what can we optimize to improve the health of this man who's in front of me, to help them achieve their goals, and how can we improve their overall health, and how can we improve their sperm health.
And I see that a lot too with my clients, because I really try to dig deeper. I think that on the surface level, it's very easy to say, well, what supplements should I be taking to optimize my chances? Because that's generally where everybody goes. And Mary's sister's cousin's brother or whatever tried this and it worked for them. I have a hard time sometimes, like really trying to dive in and peel back the layers of the health, because I don't know that, I don't know if it's just the way that our medical system is generally, again, put together, where it's like, oh, you're having this symptom, so take this medication, or you're having this, like this one thing, which is why I tend to focus personally in my practice on the overall health. Like, what are you eating? How much sleep are you getting? Even just some of the studies that I've read, where if the man's getting less than 6 hours of sleep, his sperm quality, when he sleeps 1 hour extra than that, improved by 50% just by increasing the number of hours of sleep. So you think about something like that, but no, in my experience, not a lot of doctors are asking, well, how much sleep do you get? And so I think it's really important maybe to understand, or to, at least it is for me, to really advocate for that, being very open and honest when you're looking from a holistic perspective, like what are all the things that go into good sperm health. So what are some things that you tend to see that could really benefit somebody who's like, I'm lost, I don't know, or they think that they're doing the right things and maybe they're not?
That is such a big question. I mean, that's a big part of what the consultation with a fertility specialist is about. Many times, I'd say that most non-fertility experts don't feel very well equipped, don't feel very well trained to really answer many of those questions, and many times don't have the time to do it. In our healthcare system, there can often be 15, maybe 20 minutes that you have with a healthcare provider. And so when you couple that healthcare provider is not necessarily expert in fertility, it's tough for them to dive into this more holistic, big picture approach. So I really commend you, Susan, on doing that, because it is really important to take all of those things in mind. I think about for patients, I think about kind of the medical sort of things, and also lifestyle factors that can go into a person's fertility health. On the medical side, it's things I mentioned before: diabetes and high blood pressure, and medications, surgeries that a person has had in the past. Figuring out if a man has a varicocele. These are many kind of medical issues that are really important to figure out. On the lifestyle side, you're right. There are many modifiable factors that can go a long way toward improving a man's health. And these can include, cutting down on stress, getting better exercise, keeping your weight down, medications, testosterone creams and gels that people can think, oh, this is great for my health. It's great for my muscles. It makes me more manly. But they also tell the pituitary gland that, hey, your body's got plenty of testosterone and you don't really need to make more of your own. And what goes along with that is that not only does your body stop sending out signals to make testosterone, it also stops sending out the signals to make sperm. And that happens in a large percentage of men. So I talk to my patients about those kinds of things. I also talk to them about the kind of workplace that they're in. Some men are exposed to pesticides in their work, industrial chemicals. And so that'll be part of our discussion. I worry about, in our modern world, I worry about chemicals that are just in our environment and just persist in our environment, that are really difficult to get out, from microplastics to BPA and phthalates that are just all around us and have been shown to be associated with lower sperm quality. From a sleep standpoint, you're right. I mean, I advocate for my patients. They need to get regular sleep and get 7 hours of sleep a night. Stress and high stress can do it. There was a study of medical students, maybe about 15 years ago, and they had these medical students get a semen analysis at the time of their exams, and then 3 months later when they were relaxing on the beach. And they found that there were significant differences. They were much improved when these medical students were sitting on the beach. From a diet standpoint, I'd say there's not great data on this, mostly because the studies are hard to do. But evidence showing that a good Mediterranean style diet can be really beneficial from a sperm health standpoint. Even one study that showed that seafood was good for food, and that came out of a pretty strong study design out of Boston. So anyway, there's lots a person can do if they really think about their overall health, their environment. Things like hot tubs, which are really hard on sperm. It takes 3 months for sperm to recover. So it's this long-term investment that a person has to make in their overall health. But that can pay really big dividends. It can mean that you might not have to do in vitro fertilization. You may be able to do IUI. You may be able to just have sex at home and not have to do these expensive, intensive treatments.
I really appreciate the fact that you emphasize that it takes 3 months, because I see that so often in so many clients where it's like, oh, I've had this major surgery, this major inflammation and trauma to this area, and I'm expecting that I'm going to get pregnant right out the gate as soon as I'm able, because it has happened for somebody, and just because it worked for so and so. And then when it takes time, that part can be so devastating. But it's like really understanding that you can expect that, oh, I started my diet. It's kind of like that meme, I guess, when it's like, well, I ate healthy today. Like, is all my weight gone? It's like it does not happen that way. But one of the things that is very sought after is the semen analysis, and what actually makes a high quality semen analysis, and what should people be paying attention to when they're actually reading those results?
Well, I think that's a good question. I'm going to digress just a little bit and tell a little bit about my journey. So I think it's relevant to that question. So, in my career and in my practice, the semen analysis is the starting point for so much of the evaluation. But there's often really big challenges in actually getting the semen analysis. Oftentimes, there's not a high quality lab to be able to do a semen analysis in a person's community. So men are left driving many hours to go to labs. It's a lot of time off of work. It's scheduling difficulties. And so I was facing that in San Francisco, where I had patients coming from many hours away to come in for a visit. And it was a challenge. And we could only do at our UCSF lab. It's a high quality lab, has all the kind of regulatory certifications that you need to demonstrate that you're a high quality lab. And yet we could only do 10 a day. And I was finding that my staff was spending something like 3 hours a day just scheduling semen analyses. Then the other problem was that once you got the report was kind of indecipherable for a non-specialist. They'd look at the report and not know what mattered, how do I interpret this? And the nurses in our team, as great as they are, didn't really have that specialized set of knowledge. They'd also spent a lot of time trying to track down the facts results. And so I was approached about 5 or 6 years ago from a startup company called Fellow Health. And this company asked me what the biggest pain points in my practice were. And then this is what I pointed out. And I said exactly that. And so that led me and others on a journey of how can we develop a high quality mail-in semen analysis, one that doctors would trust and trust that it accurately reflected a man's fertility potential. So we spent probably about $1 million of startup funding on trying to develop a test. And we realized that there were a number of factors that go into having a high quality test. The main thing about a semen analysis is that by the standard way of doing it, you need to get the sample into the lab and analyzed within 1 hour from the time the guy produced the sample. And that's really tough if there's no lab that's near you, and it's tough to get time off in the middle of the day. We think about the vasectomy reversal standpoint. I mean, we're often asking multiple times to do this, at a month and then a month and a half or the 2 months. And that's a really big ask for patients. It's embarrassing to go into the lab. Nobody wants to go in and masturbate and produce a sample in a lab. That's super embarrassing. So what I found as I was running these clinical trials to develop a mail-in test was that temperature was really important. You had to regulate the temperature. You needed a preservative that you could add, a liquid preservative you could add to the semen sample, and you need to get the sample quickly to the lab. So we did that, and we published our results about 4 years ago in the journal Fertility and Sterility, and showed that we had a test that was as accurate as an in-person test. That has now become the fellow semen analysis that's used in the post-vasectomy reversal standpoint, and it's been done more than 180,000 times now across the United States. So when I think about evaluating the test, one of the things that's important is looking at the regulatory certifications. And this is maybe getting into the weeds, but it's really important that a lab that does semen analysis has CLIA certification. And particularly CLIA certification is just this word for saying that a state regulatory body has come in and inspected your lab. They've looked at your data. They look at the process that you actually do the semen analysis, and they've given their stamp of approval. And so Fellow is the only high complexity semen analysis lab that offers all the regulatory approvals that are needed.
I appreciate kind of getting into the weeds a little bit because I see, there's lots of people who are just posting in Facebook groups, like, oh, I did this YO test that I got from Amazon or I'm looking under a microscope, and they're asking other people in the group, like, what are my chances? How's it looking? And so for me, it's like, well, none of that information is super helpful for helping you optimize your fertility. So while it might be fun to do science experiments and look under a microscope at home, like I think it's really important to have that quality information to make the next best decision, because I see it a lot. People will say, well, the doctor said that our sperm quality is really low, so we just need to go straight to IUI or IVF. And to me, that's kind of setting people up a little bit for failure, because if you don't have a great quality to begin with, your chances aren't going to be as good. So it's like you really want to do those foundational things health-wise. Not only you're just going to feel better and have longer longevity in life. And I mean, I had a guest on my podcast that was just talking about how when you are having a baby, part of you and part of your partner coming together, and that foundational, the DNA there is what's setting them up for a lifetime. So it's like you would want to give your best gifts whatever that looks like as far as health goes, to your child, I would hope. And so I think it's really important, but I'm curious if you've seen some common issues that can make semen analysis inaccurate or even misleading. Because if somebody gets a poor result, I see it a lot, they panic, they freak out. Um, but do you see like there's room for improvement there?
Absolutely. I mean, these days there are quite a few either do it on your own semen testing, or a couple of other mail-in testing approaches, and it takes a lot to actually have a lab and actually make sure that what you're measuring is actually reflecting what the patient is capable of. There are making sure that all of your equipment is calibrated. If the equipment's not calibrated, it's probably not going to give you a good result. To make sure that the staff is well trained and knows how to do what they need to do. Make sure that all the solutions and things that you use, also that those are good and that your suppliers are providing you good solutions, and that they haven't gone bad. So those are all things that fellow bakes into the system. If for men who are doing a sample at home, they don't have that. I mean, they're doing science, like it's a high school science class, and they're not trained to say what is the sperm shape supposed to be, or is this the proper amount of moving sperm. You can see that there's sperm there, but as far as like interpreting this and the significance of it, you really need to have a high quality lab. Many labs around the country are, and I'll say, companies like LabCorp and Quest have gotten more and more out of the business of doing this, in large part because insurance companies don't reimburse the labs well. They'll often only reimburse about $15 or so of the cost of a semen analysis. And so for a lab company like LabCorp Quest, it just doesn't make a whole lot of sense for them to do that. But then that leaves a big gap for men, and it's tough for them to go and get it done. So there just aren't that many places that, again, do it enough, have these certifications that they need so that a patient can feel like they're getting a quality test. Some labs are not able to detect sperm below a particular level. And so you'll get a report that says something like less than 5 million sperm, less than 5% motility. And you have really no idea what that means. It could be anywhere from just a little bit more than 0 up to 5 million. And higher quality labs are able to give a much more refined answer. The fellow, for example, we would say something like, you have 85,000 sperm, and can give a pretty precise answer. And again, that's the sort of thing that a high quality fertility lab would do. But there just aren't that many of those around that are really accessible or affordable for patients.
I'm glad that you brought that up because I think that that's kind of been a lot of the panic or things that I've seen where people are saying like, well, they said it was 0 and like, is it over? Am I not going to have to go and do another reversal? Is there still hope? And so I'm glad that you kind of like differentiate the difference of even just like where you have your analysis done. I mean, and even such that sometimes it's like based off of a person and their perception. So it's like, well, you know, is there a standard? Are you using a place that has a standard? Are they able to get down into the, more details to give you accurate information? So I appreciate that very much.
Right. And even is the sample truly 0? And some labs won't spin, they won't centrifuge the sample. And many times when you do that, you'll find that there are thousands of sperm cells there. And that changes completely what we're thinking about after a vasectomy reversal, whether or not it was successful or not. So again, it comes back down to this lab quality and trusting the lab quality to give you high quality information.
Good. I'm glad that you said it because I was gonna say like for couples who are sort of skeptical about at-home testing, I wanted to ask what you would say to just reassure them that the process gives them the high quality lab grade results like you get with Fellow.
Well, if you use Fellow, it's the only company that gives you these kind of high quality. You produce the sample at home, but the analysis is done in a lab that has all the trained staff and high quality equipment that you need. Doing it at home, it's tricky. If you do it at home, you're that lab staff, and you have to make sure that your phone is working properly so that it can look at the sperm cells under the microscope or whatever. And so it can work okay for some situations, but it can be very misleading in others.
For sure. Well, I am just so grateful to you for coming and sharing your experience. And I know I personally, with my clients, have loved. I actually got referred to fellow from the doctor that did our vasectomy, well, my husband's vasectomy reversal. And he was a huge advocate saying, like, this is where the people that you need to go to. And I've seen just based off of different types of tests that I've looked at from different clients all over the world that like it definitely is top notch. So I thank you for that. But before we get out of here, how much of a difference can things like diet, exercise, stress management really make in sperm quality? And are there any sort of misconceptions that you hear from time to time?
Well, I think it's tough for me. Well, first of all, thank you. I mean, one of the things about Fellow is that I'm proud of is that it's something that I feel that I can recommend to my family. I can feel I can recommend to my patients, and I can be on stage at national meetings and talk about with pride and comfort, talking about the quality of the test. And I wouldn't be associated with anything that didn't do that. So I'm grateful that it was helpful for you and your husband too. It's a pretty tricky for me to give you a exact answer to talking about how diet and lifestyle. It really depends on the circumstances. I mean, some patients come in and they really have optimized their health already. Great exercise, great diet, no pesticides to be seen. And for those patients, I don't think there's much difference. But I will say that I've seen many patients who really focus on losing weight and cutting down on alcohol, cutting down on tobacco. Improving fruits and vegetables in their diet and doing everything they can. And cutting down on stress, getting more sleep. And I've seen patients really have pretty dramatic improvements in their semen quality, but it requires a person really committed to that. And it's difficult. People would prefer to take an antioxidant supplement and hope that could work. But unfortunately that doesn't usually work reliably. It can be a fine addition to other overall health improvements you're making. But it really is important to focus on a person's overall health. And it can make a big difference. It can keep you away from the intensity of IVF, but you have to commit to it for probably 3 to 6 months. And it really does point you toward, you need to get this semen analysis and this testing early before you get to that point of feeling like you have to do in vitro fertilization.
Thank you for that. Because yes, there are a lot of different things, but even like I was talking with somebody the other day, everybody says, "Oh, I'm doing all the things," but I can usually find some things that you can do to sort of optimize just even how you feel. If they talk about how like male fertility as a whole is declining, and the statistics is saying by like 2045, it's going to be at zero because it's declined 50% over the last 20 years or something. So it's definitely something that I think is becoming a bit more mainstream as far as being concerned about, because it's always been, I think, a little bit more hyper focused on the female side of things, but obviously it takes two. So I do appreciate that there is more talk about all of these things that go hand in hand, and certainly sperm health is a very hyper focus for most of my clients, to where a lot of times the woman is maybe neglecting the things she should be doing because they've spent lots of money on the male side. But I appreciate that you say that there are lots of different layers to it. Is there anything else that you would want to tell somebody who's kind of in this boat of like, they've had the reversal or they're contemplating it and they want a baby like yesterday and they just want to know, like, what do I do? Is there any sort of like message or some sort of nugget of information you could give to somebody who's just so desperate for a baby?
Wow, we could start our podcast discussion over and just dive into that one and just to make that a nugget. I mean, I'll have conversations with patients when I'm talking about vasectomy reversal or jumping straight to in vitro fertilization and trying to decide what's best for them and what's best for them as a family. When thinking about a vasectomy reversal, just you kind of have to be patient. You want to see a specialist, you want to see a reproductive urologist who's an expert in microsurgery. It's sometimes tempting to find a place that's the kind of the lowest price out there, but the best chance of success is going to be done by a fellowship trained microsurgeon reproductive urologist. So that's really what you're looking for. Most reproductive urologists are going to have success rates better than 90%, even 95% or higher, depending on the circumstances. So that I'd say that probably the most important thing. After that, you want to get your semen analysis regularly. So don't just forget about that. Make sure that you check and listen to your doctor. Typically, if you get a semen analysis at a month or so after, a month and a half after, and then get that regularly until your semen analysis comes to what it stabilizes, you're going to be able to identify problems early. And like Susan, like you had mentioned, if you had some sperm and then it disappears, then that can suggest some inflammation at the site of the vasectomy reversal. So I don't know if that's exactly a nugget. That's kind of like a bushel of nuggets.
Yeah, no, I love that because that was the case for us where so my husband had the VEVE connection, and the first analysis they were kind of like, oh, well, it's good that there's some getting through there. It's not the numbers aren't great, but we expected that. And then by 8 weeks we were at zero, and I was devastated. Like this is the end of the road for us, and our doctor, who was amazing, didn't have any qualms about that. But he's like, this is why I do have you do these analysis every 4 weeks, because if there is inflammation, there are things that we can do, protocols that we can do, medications we can administer to sort of like help that. So he gave us a list of things to do. And my husband was very meticulous about icing, avoiding heat, like all of the things, taking his anti-inflammatories. And by the next analysis, the numbers were back to amazing and continue to improve and stabilize after about 4 months. So I kind of tend to lean into that, like, yes, it's not a comfortable thing to get tested often, but the earlier you can catch any kind of inflammation, healing, and whatever, then it gives you information on what to do next. And I think that for a lot of people, that sort of is a missing piece maybe in their follow-up care, is the importance of like understanding that inflammation is part of the body's healing process. And in that you may get zero. And while that's discouraging, it's like there are things you could do, but not waiting until 6 months, 8 months, 9 months down the road to get that information to do whatever you need to do to reduce your inflammation, because our lives are just full of inflammation causing things as it is, right?
Well, I agree with all of that. I would say that typically if you look at men getting a semen analysis after for fertility reasons, typically it's something in the range of 30 to 50% of men are actually following through and getting a semen analysis when their doctor is saying to get it done, because of all these barriers we've talked about. It's embarrassing. You don't want to go to the doctor for this. So we have actually just presented data at American Society of Reproductive Medicine where we looked at vasectomy reversal specifically, and using fellow was better than 90% of men were getting it done when their doctor wanted to get it done. And so it was really a very striking difference when you can use a high quality test at home, get results that come right to your phone. You don't, it really, it takes out some of the reasons for saying no. And it is important to get this testing done so that your doctor can help you have a baby.
For sure. Well, and I'll make sure that all of that information on how to find fellow and get your test is all included in the show notes. But is there anything else that you want to add before we jump off here?
It's been a pleasure to be with you today, Susan. Thank you for having me on.
Thanks so much for being here and sharing all of your amazing knowledge. And I'm excited because I know that this will be a game changer for a lot of people who may have had reluctancy or whatever barriers that were holding them back, but equip them with information so that they can take action and feel like they're empowered to do what needs to be done next. So thank you so much. I appreciate you.
It's my pleasure.
Thank you so much for joining me on Conceiving After Vasectomy Reversal. I hope you're feeling encouraged and more hopeful on your journey to growing your family. If you enjoyed today's episode, please take a moment to subscribe, leave a review, and share it with someone who could use a little extra support. I absolutely love reading your reviews. They mean the world to me. Like, seriously, words of affirmation are my love language. So let's stay connected. Find me on Instagram at conceivingaftervr and join our Conceiving After Vasectomy Reversal Facebook community for even more support and encouragement. I believe that God placed the desire for a child on your heart for a reason, and I'm grateful to walk alongside you in this season, to encourage you, and to help you find joy in the journey, trusting that His plan is greater than we can ever imagine.
Thanks for listening.